Now they can get back to doing what they love, enjoying their life, et cetera, et cetera. Let them be your advocate, tell your story, and then promote that on your website and your social, and kind of lean into the community aspect that, this is a friend, neighbor, coworker, colleague, whatever, that's right here with us.
Hey there, welcome to the Dr. Marketing Tips Podcast. I am Jennifer.
And I'm Corey.
And today we're diving into a topic that may seem a little niche at first glance. It's Medicare's drug price negotiation program and the pushback from independent pharmacies. But it actually has broad implications for our entire healthcare ecosystem, especially from a marketing perspective.
Yeah, so if you're listening to this, you may or may not be involved in pharmacy, but this conversation matters because it highlights how policies aimed at reducing costs can impact the care that you're giving at your clinic, office, practice, whatever setting that you're offering care. So this isn't really, it's not just about numbers and regulations, because I think that's something, we all need to kind of pay attention to. But at the same time, it's about how this is affecting independent groups, whether that's a pharmacy or a medical practice, and knowing that we still need to focus on, the things that we can control, and that's putting your best foot forward from a marketing perspective, and how if you do that, you should help shield yourself a little bit from some of these policy changes, even though they may be up in the air at the time that you're listening or watching this.
Yeah, so we're recording this mid-March, and literally last night at midnight, the tariffs on steel and aluminum took effect. And you're seeing it across the board in the news today. Is like all the small businesses. I mean, there's just so much uncertainty because of what's happening from Washington and trickling down. And kind of this idea around what happened to independent pharmacies, it applies to independent orthopedic practices, independent, primary care practices, you name it, because there's always things happening at the national and the state level that are going to impact your bottom line. And so we're seeing it with small businesses. We're seeing with the independent pharmacies saying this could put them out of business, but we're also seeing it, in everyday policy changes. I think, kind of to your point, Corey, you can't stress out about everything that's happening that's out of your control in Washington, in our case, we're in Florida, in Tallahassee, in your state, state legislature. But what you can focus on are the things you can control. That's what this episode's about.
Yeah, for sure. And just again, to kind of like clarify for people that are listening that may or may not be familiar with what's going on. So essentially, Medicare wants to negotiate lower prices for some expensive prescription drugs, which sounds like a good idea for the average consumer.
And it is.
It is, yeah.
Good idea for the average.
For sure. And independent pharmacies are saying, well, if this happens, it could put us out of business. And that means, again, for the consumer, maybe there's fewer choices, fewer places to get medicine, longer wait times, et cetera, et cetera. So they're kind of making this argument that, we are on board with this on some level, but we also have to watch our bottom line, essentially. And so what we wanted to do was explore some questions and maybe hopefully provide some answers that allow for some actionable kind of insights on what we can do from a marketing side as these changes kind of roll out, and also just in general to make sure that you're, again, putting your best foot forward.
Okay, so specific to independent pharmacies, like specifically for this Medicare drug price negotiation program, how should we frame the impact of what this means?
I think we can frame that as a challenge to the status quo. So the policy is designed to lower costs, but again, the argument would be that it could potentially risk undermining this flexibility, this personalized service that these independent pharmacies are known for. So in your messaging, you could lean into the fact that you are independent, and with that comes these benefits. That's why you choose us over, a CVS or a Walgreens or whatever. And so it's about these trusted relationships, this local expertise. We're part of your community. We've been here since X amount of time. We have tailored services to serve you better. that these bigger systems may overlook or may not be able to pivot and focus around, which again is kind of a parallel to what we talk about a lot with independent practices, where, if you're going up against a health system, one of the things you can do is say, well, we aren't this big behemoth, right? We can pivot, we can change, we are part of the community, we are business owners, just like, the people that we serve. And so I think that those two things kind of go hand in hand.
Yeah, I do. And I think that as it relates to independent pharmacies, but also others, you have different messages for different audiences. So with independent, or for let's just say with pharmacy. So with pharmacy, you've got, your consumer focus. So your messaging is we're more flexible, we're more nimble. Yes, it can be cost, but everything shouldn't be about cost all the
Mhm.
time, which is hard to say when, we're not sure if there's going to be a recession, or we're not sure what's happening. We're not sure with interest rates. But then separately, you've got, for pharmacies in particular, you have the audience to the physician groups. And, a lot of times we're marketing to those physician practices to send us their patients. And so now we have to change that narrative slightly, and not make it just about cost. Because if you've commoditized your practice and made it about cost, whether it's drugs, whether it's Botox and fillers and, and GLP-1s or whatever it is, if it becomes about price, you're always going to be at risk for things that are policy driven from the top down. Always.
Yeah, as an example there, some pharmacies that we work with know that it can't just be about cost. So what are some of the other things that can differentiate us? And, you'll have to obviously figure this out for your group, but one thing that we've had success doing is marketing that there's an additional level of access here to the pharmacist. So that could be anything from having a chatbot as an example, where you can actually like connect and talk to the pharmacist if you're a patient there. That's not something that you can get everywhere. And again, the pharmacist, the person on the other line, where that you could have essentially quote unquote office hours. And let's say Monday from 2 to 6, you can talk to the pharmacist. That's something that's unique. It provides an additional level of access. That's a way to build loyalty and authority, and cost has no bearing on that, because to some people that's going to be really important that they can reach out and do that. Another thing is potentially creating a resource library. So having how-to videos for injections, or these starter guides and things like that are customized to the person. Again, that's value that you can give to someone that's independent of cost. So I think just a couple of ideas on things, maybe to hopefully get your head around what can I offer that's not just cost, that you can turn around and give to patients.
Yeah, and I think it kind of goes to like the next point is, if it's not just about cost, what makes you different? Well, the fact that you're independent as a practice, that is a big differentiator. So leaning into, effective storytelling related to the fact that you're independent. I've already pre-planned out all of our IMG Insight Marketing Group newsletters to go out to our specialty groups in July. And we are leaning into a message that's like, July 4th isn't just celebrating independence for the country, but it's also about celebrating your independence as a practice, and really leaning into that from a storytelling standpoint, because you're always looking for what can I say that's going to differentiate me from the big box retailer or the big box, hospital chain or system down the road. And I think good storytelling will always do that, especially for independents.
Well, and also I think you have, I'm sure, some patients that are good storytellers, and they would want to share their story about how you help them. So regardless of whether you're a pharmacy or a dermatologist, orthopedic practice, whatever, you identify those patients and then share their stories. We've been talking about that forever. It has been incredibly successful as a marketing tool to be able to say, here's a patient, here's what they went through, and on the other side of the procedure, the prescription, whatever, now they can get back to doing what they love, enjoying their life, et cetera, et cetera. Let them be your advocate, tell your story, and then promote that on your website and your social, and kind of lean into the community aspect that, this is a uh, friend, neighbor, coworker, colleague, whatever, that's right here with us. and they are experiencing these benefits, and you can too.
It's funny. We have a ortho group that we're running some commercials for. We're dabbing our toe in. I don't want to call it TV, but it's TV. So OTT, over the top advertising. And we're running we have two campaigns running. One of them is called Your Story Here. And it's literally taking those patient stories. I came here because now I'm back to doing whatever it is I love. Like, I didn't expect I could pick up my grandkids from the floor, but I can do that now. I didn't expect that I could go back to work. I didn't expect that I'd be able to run a marathon, but I'm running a marathon thanks to this practice. And so everything's your story here, because patients will tell the best stories. And as we're looking at the data, which I want to talk about data, as we're looking at the data of which one of our tests are performing the best, Your Story Here, which is the campaign, is performing almost 2-to-1 on certain networks better than our other campaign, which was more about the doctor. Really interesting piece.
Yeah, I mean, if you think about it, and we've all seen hundreds of ads across, whether it's TV,
Thousands.
print, yeah, whatever. But if you look at one where let's use like YouTube as an example, if you've got 15 seconds to capture someone's attention, and sometimes you see the ads where it's all text-based, or it's very clearly stock footage with some nice piano in the background, like, you kind of automatically tune those out unless you're really interested in the product. But if it pops up and it's just like a regular looking person that you'd see at the grocery store, and they're saying, I never thought that I'd be able to pick up my granddaughter again, or whatever the case may be, there's an emotional hook there. You are immediately establishing that whoever performed X procedure or gave X prescription is an authority. And again, you're just leaning into the fact that this is a real story from a real person, and that is powerful compared to just what you see oftentimes with, I'll use health systems as an example. Usually they have this really robust and well produced and choreographed story where it looks like a little movie, which is nice. But I think that there's just power in leaning into the realness of a patient testimonial. So
I couldn't agree more. I think, and I don't know how well, it's tough when you're in places like New York that don't let you use patient testimonials in your market. But if you are in a state that allows you to do it, this could be your number one way to market your practice. And we've been saying it for years. Put the patient first, because their stories are going to convince everybody else. So let's talk about data. Like, as an independent practice, we have all kinds of data that comes in, especially like outcome data and things like that. How can we use that data in our marketing to help differentiate outside of pricing? Because if you've been hanging your hat on price, we know that policies are coming down that are going to squeeze every dollar out of everybody. How can we use data to help differentiate the practice?
Yeah, well, I think the thing to remember is that data is your friend. So you can't manage what you can't measure. So you need to make sure that you're using some form of data. Hopefully you've got Google Analytics or something set up on your website, and you can at least see what pages are performing, what people are looking at, and sort of use that maybe to create a content calendar. I think that's one way you can easily use data. You can say, for example, you mentioned GLP-1s. You can say, I've got this page on my website. Over the past 9 months, I've seen a huge spike in that. So let's talk about that. I think that's very like marketing 101. For other data points, you could look at maybe taking things that are happening at the macro level, at the national level, and using that to build some type of an infographic, for example, that you could then use on social, or maybe you then put that in an ad or put it on your website and say, like, this percentage change results in, like X results in Y for you locally, and sort of break it down for the average consumer. Again, you mentioned different audiences. So how does that relate to me as a potential patient of your pharmacy or your medical practice? So if you can make me understand it, the average reading level is like 7th to 9th grade or whatever. Break it down so I understand what's happening. Then, maybe that can either help me become an advocate for you once I understand what the actual problem is, especially if this is a relationship that we've had for quite a while, and I go to the pharmacy every 2 weeks, and they know my name when I walk in and that kind of thing. But if it's over my head, I'm not going to pay attention to it at all. So I think you need to find the way that data can work for you to assist in your storytelling, but also use it as an opportunity to create content that's going to resonate, because you, again, should know what people are actually paying attention to based on the data that you've got.
Yeah. And I think also, like you said it, like create content. So I think as we're thinking about like what content can we create, if you are hell bent on making a thing about policy changes, like if you are really focused, we can start incorporating some of those conversations around policy into the content that we're creating. I don't mean that you're saying like, hey, patient, go send, an email to our elected officials. I'm not encouraging that. I'm saying like, let's say that a policy decision comes down from the top and it's really kind of a one size fits all, which is typically what we see. You could start producing content that is directly kind of trying to like turn on a light bulb with people as it's resonating. And you could produce a piece of content that says like, our practice is not a one size fits all. Instead, we're highly personalized, we're customized, we're this, we're that. And you could start juxtaposing whatever that policy stuff is coming down from the top and positioning yourself against it or for it or whatnot, really planting the seeds to conversations. And you don't just have to do that with patients and searchable items. You could be marketing to employees, to your physicians, getting everybody on point so that you're prepared if you need to have that greater conversation. Everybody should have those talking points. It's not about price. It's about X, Y, and Z. So I think you can start crafting that messaging internally.
Yeah, and I think you kind of think of it like, so there's a term called brand hijacking,
Mhm.
where if, let's say, a brand is spending a bunch of money on just getting their message out there.
You mean like the hospitals?
Exactly. You can sort of ride those coattails because they're raising awareness about a particular thing. So, for example, if there's a big policy change, and if you turn on the news and there's a politician talking about it, they're going to all have the same talking points. They're going to all say one size fits all, just as an example. So what you could do is use that same phrase in what you're doing, and that will help sort of generate this organic, like earned attention without spending any of the money that they're spending. You're just kind of riding the wave along with them. And I think that's a really good point on how you can sort of tweak the message, but still take advantage of the heightened attention around whatever the issue is.
Absolutely. We were talking about it yesterday. We were talking about like an MSK approach, and how do we jump on the GLP-1 discussion for MSK? And we can talk about weight loss as it relates to knee surgery or hip surgery or something like that. And we were trying to decide, is the juice worth the squeeze in terms of our effort to jump on that bandwagon. But, to your point, I love the term brand hijacking because we don't always think about that, but we could do that in certain instances. And that's a way that smaller, independent, nimble practices could jump on and, get into that limelight, which we've talked about in the past. Like, they're talking about something in the news, jump on social media and talk about something similar.
Mhm.
An athlete gets injured, go talk about Tommy John surgery, things of that nature.
Right, because there's going to be heightened interest around it for sure.
Yeah. So let's wrap it up. So, I mean, basically, this discussion isn't just for, industry insiders or independent pharmacies. I mean, yeah, the issue right here is directly related to drug price changes, coming down from the top, but it's really about anybody who cares about how the system is evolving and how those things at the top are coming down and affecting our practices. But at the end of the day, it's so important to pay attention to policy decisions, but not let them just pull the rug out from under you.
Right, especially if what you hear on a Monday is different on a Wednesday. So you spent your Tuesday shifting, and then it's all for naught. I would say key takeaway for me is that engagement really matters, and just like what we have always kind of been preaching, that creating these campaigns, this content, really can help put your best foot forward. And if you're doing those things, if you're leaning into the storytelling, and these sort of real life tangible benefits, then that's going to help you weather the storm. That may or may
So,
not be.
absolutely. So with that, I'm Jennifer.
I'm Corey.
And we'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Thanks, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.